Hi, I'm Jason. I'm the founder of My Rehab Connection, and I'm also a clinician here at Great Chiropractic Spine and Joint Clinic located in St. Catharines, Ontario. And what I'm going to do in this video is review a few of the key tests that we would do in our office to assess the hip. And I'm not only going to show you how we do this here in the clinic, but I'll also show you how you can do these tests yourself at home to get a sense of how healthy and how mobile your hips are, or alternatively, where there may be some issues that need to be addressed. Now, keep in mind that the hip is a complicated area. So to assess the hip, we are actually going to need to perform several different tests to get a full and accurate picture of the overall physical health of this region. And in practice, we would typically perform all of these tests during a routine hip assessment. But for the sake of demonstration and to keep these videos a little bit more focused, I'm going to separate these tests based on the region of the hip and by the muscles that we are trying to evaluate with these tests. So in this video, I'll go over the tests that we would typically use to assess the anterior region of the hip, which primarily involves the anterior hip capsule and the hip flexor muscle group, which includes the psoas and iliacus muscles, which live deep over the front of the hip, the TFL or the tensor fascia lata muscle, which is found along the lateral anterior aspect of the hip and connects into the IT band. And this hip flexor group would also include the rectus femoris muscle, which is also part of the quadricep group, but crosses the anterior hip to affect the hip joint as well as the knee. Then into accompanying videos, I will review the tests that we would use to assess the posterior lateral hip, which would include the gluteal muscle group, as well as how to assess the posterior hip capsule and the deep rotator muscles of the hip. And what I'll do is I will add links to those videos in the description below for this video. So with that said, let's review how to assess the anterior hip. Perhaps the easiest and most basic and really the most classic test for the anterior hip and for the hip flexors is what we call a modified Thomas test. So there's a few key things that we want to keep in mind for the setup here, because this is going to really make a difference on getting the accurate information that we want from this test. So first off, what we're going to do is we need to be able to sit on the side of something as firm as possible. And what you want to do is have the patient or yourself, if you're doing this on yourself at home, is you want to slide your hips absolutely as far forward as possible to right towards the edge of that surface. If we're going to test the left leg, right leg comes way up nice and high, pulling it in towards the chest. And then from here, just going to rock backwards. I'm going to hold that leg to kind of let it come with us. Now we want to keep that knee up towards the chest so it flattens the back. If I'm doing that hip against that foot a little bit just to stabilize it a little bit. Now from here, we're just going to, in a relaxed position, let that knee and that thigh drop down as far as we can. And we want to make sure that's just a nice relaxed hang there. And what we're looking for is a couple things. So first off, we're looking at the angle of the thigh here. What we want to see here is we want this thigh to be horizontal, all right? And if that thigh is kind of up a little bit, as if there's a little bit of a gap between the upper leg and that table, that's a sign that there's going to be some tension in through this hip flexor group that we might need to address. But remember, this hip flexor group involves a couple different muscles here, okay? So the other thing that we can look for is what is the angle of the lower leg here? And as it drops down, what we ideally would like to see is this knee stays bent 90 degrees, and so this lower leg is hanging a little bit more straight down. And if it's not, if that lower leg is a little bit more extended, then that's an indication that it might be more that rectus femoris. Remember, that's the muscle that crosses the hip but also goes into the knee here. So if your lower leg is more extended, it may be more that rectus femoris that's the bigger issue here that needs to be addressed. All right. And the other muscle that we talked about was this TFL, this tensor fascia lata. This is more on the front of the hip, but a little bit more towards the side. And its attachment is not so much into the bone here, but it goes into the IT band located on the lateral aspect of the thigh. And if this is going to be an issue, oftentimes what we're going to see is as that leg drops down, it's going to get pulled out to the side into this AB or abducted position. And that's more of an indication, it's more this lateral group of tissue that may be influencing the hip and limiting that extension. And if that's the case, we might need to direct our efforts more towards that lateral aspect of the hip in order to resolve the hip issue. All right, so that modified Thomas test is looking at flexibility, which is important, but remember, it's not the only thing that we need to assess. We also want to make sure those muscles are contracting the way they are supposed to and that they're controlling the hip in the way that they're supposed to. So in order to check strength and contraction of these hip flexor groups, all we're going to do is lift that leg up towards the ceiling and then let it back down. Now, nothing too fancy here. In this example, all we're doing is saying, can we put some contraction and some load through that hip? We want to make sure that it doesn't hurt. And this should be a relatively easy thing for you or for your patient to do. Now, if we're coming up again, just lift for me. The other thing we can do is just light little pressure down. So just resist. Again, just making that contract a little bit harder just to make sure that that muscle is contracting that the way that it should. The other thing to keep in mind is we want to make sure that we're testing contraction of that muscle group through the entire range. And when we're lifting up from this position, it gets a little bit more of the stretched or mid-range, but we also want to make sure the short range contraction is going to be working the way it's supposed to and won't be an issue as well. So to do this from the same position, we can just sit up. Right? So now the hip is starting from a little bit of a more flexed position. And this is the same thing. We're just lifting that leg a little bit up towards the ceiling. Just want to make sure that this can be done. And if we lift up again, we can apply just a very light pressure here. You can resist. Again, we're just making sure that that muscle or those muscles in and around the hip that control hip flexion are contracting the way they're supposed to. So we want to make sure that this is something that the person can do or that you can do. And we want to make sure that that contraction doesn't cause pain or symptoms as well. Now, before I end the video, there's just a few more things that you might find helpful. First, as I mentioned in the video, I have also done 2 accompanying videos that discuss how to assess the anterior hip and the hip flexor group, as well as the posterior lateral hip and the gluteal muscles. Now, if you want to learn a little bit more about the causes of non-traumatic hip pain and understand why so many hip conditions just seem to show up out of nowhere for no obvious reason, you can check out my video on the common causes of non-traumatic hip pain. And finally, if you want to learn a little bit more about how I actually go about treating these non-traumatic hip conditions, I have a video that covers that as well. And all of those videos are available on the hip pain section of my website. And I will also include links to all of those videos in the description below for this video.